Hello, everyone, and welcome to this webinar of the Société Santé en Français. For those of you who are not familiar with our organism, I would like to introduce you to the SSF. So the Société Santé en Français is a dynamic national association whose objective is to promote the development of French language health for Francophone and Acadian minority communities in Canada. SSF is a hub of 16 regional, provincial, and territorial networks working in concert with partners that are involved in improving access to French language health services in all provinces and territories where French is not the majority language. My name is Adam Berada. I am a public relations officer at the SSF, and I'll be your host for the next hour. Before getting started, we'd like to acknowledge that our offices located in Ottawa are on the unceded and surrendered territory of the Algonquin Anishinaabe people, whose presence here reaches back to time immemorial. The Société Santé en Français honors the traditional territories upon which our staff and partners live, work, and play. So, this webinar objectives is to improve access to new knowledge, to facilitate evidence-informed decision-making, and to foster interactions between knowledge producers and users. Our presenters today are Mrs. Danielle de Moissac, PhD, full professor at the University of Saint Boniface in Manitoba, and Mrs. Joanne Chalifour, consultant with numerous years of experience. So Ms. de Moissac is a full professor in the Faculty of Science at the University of Saint Boniface. She currently leads a research program on health and access to health and social services in French for Francophone living in minority situations in Manitoba and elsewhere in Canada. She recently obtained funding from the SSF to set up a screening and referral program for at-risk post-secondary students in 3 post-secondary institutions in Manitoba, Saskatchewan, and Northern Ontario. Joanne Chalifour is a consultant with 20 years management experience, specializing in community development, quality assurance, and French language services. Prior to becoming a consultant, she held management positions in the health and social services sector with the following organizations: the Centre d'accueil Héritage in Toronto, the Centre de santé communautaire of Hamilton, Niagara, and the Alzheimer's Society of Brant, Haldimand, Norfolk, Hamilton, and Halton. And I could give you more achievements of our presenters, but we're lacking time for today. So we just go on with our presentation. A few housekeeping items before getting started. You are automatically on mute since it's a webinar mode. If you want to participate, you have 2 options at the bottom of Zoom app. You can write during the webinar in the chat box or in the Q&A box at the bottom of your screen. We will have an interactive survey during the webinar. It's optional and totally anonymous. You can just tick the box that corresponds to your answer. And about the resource sharing, the documentation, presentation, and webinar recording will be available on the SSF website following the webinar. So we'll begin with an overview of the Equity-Link initiative, and I give the floor to Joanne. Joanne, the stage is yours.
Merci, Adam. Hello, everyone. Funded by Health Canada and launched in March 2021, equity-link is a free, unique, confidential, and centralized platform that supports the implementation of French language health services within health, social services, and/or community organizations across the country. Next, please. This online platform is designed to guide managers so that they can first know where to start through a self-assessment tool that will guide them through the process of identifying their organizational strengths and areas for improvement regarding French language services. This baseline data is presented in a dashboard that will provide suggestions for their next implementation step, as well as provide them with a comparative analysis of their progress. Second, it provides them with the tools, training, and resources to do it. And third, support them in implementing and evaluating proven solutions and tools that can be adapted nationwide, helping to improve access to safe, quality care in French. To facilitate this work, equity-link is accessible on all digital platforms and supported by experts. It adapts and integrates easily to any level of progress in the implementation of French language services. The flexibility of the platform allows organizations to assess their current Francophone capabilities and navigate the best process forward at their own pace. It is available 24/7 and lets you navigate from French to English to support English-speaking partners. Now, how to increase the access by using this platform? We have four main pillars: guide, connect, empower, and sustain. So it guides healthcare providers through the necessary steps to address barriers to implement proven solutions. This is done by direct support from experts. It connects by bringing together evidence-based, validated tools that can help providers understand the process to follow in establishing best practices. Empower users by enabling them to assess their current ability to provide services in French and improve their performance by following at their own pace the exemplary approach proposed with the support of experts. And sustain the offer of services in French and use the lessons learned to apply and adapt them to meet the needs of underserved communities. It's easy to benefit from the tools, training, and resources on this platform, and you can easily register with one click at equity-link.ca. Next slide. So I think it's sorry, if you can, Adam, if you can go back to the resources. The platform brings together several resources certified by the college, the Canadian College of Health Leaders, and we won't dive into each one of them because we prefer that you do it and explore it at your own pace. However, we recommend starting with Equity Fundamentals. It is your A to Z guide that is intended to support managers in the planning, implementation, and evaluation of French language services. Any organization can benefit from this resource and use it to assess the status of its French language services and also identify the next steps through recommended strategies to develop a personalized action plan. We also talk about the Café de Paris approach as one of the resources, the communities of practice, and how to use a collaborative approach to increase French language services in your community. There's a logic model guide, the bilingual health workforce strategy 2.0, the active offer of French health services, and today's focus is the policy guide to support French language services. And now it is my pleasure to introduce you to my colleague, Dr. Danielle de Moissac.
Merci, Joanne. Hello, everybody. I'm very pleased to be with you this morning. So yes, why develop a policy guide? Maybe I'll back up a little bit just to make sure that we're all on the same page here. So I'm sure you're aware that in all provinces and territories in Canada, except from Quebec, the majority language is English. But there are many, many Francophone communities across the country. And as Canada has two official languages, it's important that we be able to provide services in both official languages. It's been shown through many studies that receiving care in your maternal tongue has a very high impact, not only on your personal health outcomes, but also on the health system. It saves money, it saves lives. And so we really need to see how we can better implement active offer of services in French. And the first step to that is developing a French language service policy. Basically the fundamental thing about our study here is that an active, regular, and permanent offer of services in French necessarily involves the implementation of language policies and their related procedures. So the development of such a policy and procedures is really the first step, an important first step for any organization who wishes to improve on their access of services to French for their population. This 4-hour training session is designed to support organizations in developing their language policy. And for certified members of the Canadian College of Health Leaders, This training is worth 2 MOC Category 2 credits towards the requirement to maintain their certification. And as well, a certificate of participation is issued once evaluations for each module are completed. Next slide, please. So about this training. This training is really based on a body of research and analysis that was conducted with Joanna and myself, basically looking at current practices that aim at fostering the implementation of such policies and procedures in both health and social service organizations that currently serve Francophones and Acadians across Canada. So our main objective was really to develop a French language service policy template that could be used by other organizations who are beginning their journey on this level, and to suggest ways to implement this policy for designated health and social service institutions. Next slide. So we chose how can I say it, a very approach for as a methodology. We wanted to start off with a literature review to see what was actually had been published pertaining to French language service policies and procedures within health and social service organizations. We then wanted to speak with managers who had either had developed their own policy or had to implement the policy within their organization. And we then looked at, we collected a series of policies and procedures, we analyzed these, and to then develop a template, and to as well as a guide to assist new managers into developing their own policy for their own organization. We really hope that these tools will serve as a model for these other organizations who wish to improve access to French language services in their environment. Next slide. So I'll jump right into the interviews that we conducted with managers. You'll see here a list of participants, which there are 12. Actually, how did we go about finding these managers? Well, we had a brainstorming session between Joanne, myself, and the person responsible for this project, who has very good knowledge of the SSF network. And so together we thought of past or present collaborators that we've had in communities across Canada who are involved in health or social services. And we came up with a list. We made a few phone calls. Those who were willing to participate or had policies to contribute were chosen to stay on the list. And then we added a few more just to have a better representation of geographical settings. We wanted something pretty much across Canada and in the territories as well. And we were also looking for different types of services. So hospital settings, health authorities, long-term care, community services. So in the very small box on the right side of the slide, that's a summary, shows you that we had 2 health authorities, 5 different hospitals, 3 long-term care homes, 2 health community centers, for a total of 12 participants. Next slide. So in total, we collected 27 policies and procedures pertaining to French language services. We were very happy to have this amount, very rich in a lot of material for us to work with. So that was very awesome. I have to add that the participants were very eager to share their policies and the procedures, very willing to, to improve in whichever way they could and help out other institutions or other organizations across the country. So that was very, I thought it was worth mentioning. Apart from having access to their policies and the procedures, the participants shared quite a few things actually that we were not expecting, but we thought that would be important to you who may be in the process of developing your own policy. And so some participants mentioned that you can assess the impact of your language policy and have it measured objectively. by an external agency. I don't know if you're aware of the Accreditation Canada's Official Languages Recognition Program, but maybe look into that because that could be very helpful. And there's also the HSO Access to Health and Social Services in Official Languages Standard that may be helpful because it really allows you to, it gives you guidelines to excellence and helps you measure to what extent you're meeting the minimum requirements for the provision of social and health services in Canada to official languages. So it might be a helpful tool to use. The results that we obtained really are reflected with what we had read in the literature review. So we really feel that what we're presenting today is not only our research, but as well as that done by others. What the participants mentioned was that having a policy is really, it's the first step in providing services in both official languages outside Quebec, because it provides the vision and the mechanism by which this can be achieved. So it's really setting down on paper what you have, what you want, what your vision is, and how you're going to go about getting to your objectives. So it's a very important part of developing French language services. Next slide. As I was saying, the participants mentioned other things as well. So policies and procedures developed. They shared different practices that they had developed over time that they felt were helpful in implementing the policy. Most of them mentioned signage within the building, communications, whether it be on your website or when you're answering the phone, the language of work language. They mentioned designation of bilingual positions and how language competencies are assessed. Many mentioned translation and interpretation services as well. So that's pretty ballpark the thoughts that came out from conversing with these managers. One point, or actually 2 points that they wanted to put, that many of them pointed out, was that you need to be able to measure the impact of your policy. And so you have to think about that as you're writing up your policy. How am I going to demonstrate with numbers that that this policy is actually working for us? And the second thing to really consider is dissemination of policies to staff. You know, this policy can't stay in a binder. It has to be a live document. It has to be shared and shared again and shared again, because you can't share it enough. People need to be aware of the policy, and they need to be aware of what tools are available to help them implement the policy and what resources are available to them. So that's all this communication regarding the new policy needs to be, it's a long-term process. Participants or managers actually shared challenges that they had, because you can very well imagine it's not always that easy to implement a French language service policy in a very Anglophone environment. So there are challenges, but there are also success stories, and those are shared in the report that emerged from our study, and that will be available on the website shortly. Next slide, please. So in working with Joanne, we identified key items to include in policies. That comes from looking at the policies that we collected. The first thing being the provincial legislative framework. So you need to have an idea of what the framework in your jurisdiction is. Secondly is the commitment from governance within your organization. How important is the French language services? It needs to be a fundamental value for the organization for it to be implemented well. Thirdly, the model by which French language services are actively offered and how this is communicated within the organization to both staff and clients. So we need to know how we're going to go about this, and how are we going to let both the staff and the community know what we are doing and what is available to them. Fourth, the organization's approach to planning services in French. So it's not only, okay, let's put this into place today, but we need to plan for the future. How are we going to improve recruitment of bilingual staff, for example? What strategies are we going to use to help them maintain their language competencies? Many different approaches that can be planned and that need to be planned for them to be pursued over a long period of time. Next slide. The organization's approach to consulting and communicating with the Francophone community. So we can't work in silos, though that is very much the tendency. We need to be consulting and speaking with the Francophones to see what their needs are and to make them aware that resources may be limited, but you're very willing to implement whatever it is you can, and perhaps what are the best first steps to look into. The next is how complaints about French language services are managed, who receives them, who will respond to them. And then communication, as I mentioned before, including signage and messages, language of service, and professional interpretation and translation services. And finally, but not the least, the human resources plan, which is really key for active officer services. So do we, like, how many positions are designated bilingual? How is language assessed, language skills assessed, the staffing, how the organization identifies bilingual employees and keeps this information to date. That's really a big part of knowing who is able to provide services in French and who is able to assist. Next slide. And so in working with these policies, Joanne and I came up with 4 recommendations that we believe will be helpful to you. The first being having a well-organized, clearly worded language policy. It really needs to be simple, to the point, but easily understood by both by staff members, like whether they be health professionals or managers. Second recommendation is to support the dissemination and implementation of the language policy. It can't be a document kept in a binder. It really needs to be shared, and it needs to be implemented with tools and resources. Third recommendation is to designate a French language leader and a team of champions within the organization. So somebody has to take this on, but they can't do it alone. They need to work as a team so that the dissemination and implementation of your policy can be integrated into every aspect of the work environment. And the last recommendation is to make the organization's commitment to the French-speaking community visible so that it becomes part of everyday business. So clients coming in are aware that services in French are available, or some of them are. They just need to know that it's something that the organization prioritizes or values, and that will make the whole difference. Joanne, je te passe la parole.
Merci. So the goal of the training is to help users first to understand the importance of language policy and procedures that are aimed at improving the active offer of French language health services for health and social service organizations that serve Francophone and Acadian minority communities in Canada. Another goal is to know how to design a policy that is tailored to their needs and that is based on recommendations stemming from research and evidence-based practice, to learn about practices that promote the implementation of language policies and procedures, as well as understanding potential challenges, and to assess the impact of language policies and procedures aimed at improving access to quality and safe healthcare services in French. Next slide, please. So the training is divided in 4 modules. The first one helps to understand the importance of having a linguistic or a language policy for your French language services. And the second module is to describe how to develop a policy that will help to identify the characteristics of a policy that is well designed and that is also adapted to the need of your organizations. The third module explains how to implement the policy and the procedures. And finally, the last module describes how to evaluate them. Next slide, please. So what you will find in the guide, information, a step-by-step approach, a template in English and French to use, and also examples. Next slide. So as Danielle explained, the main objective of our study was to create a template for the language policy that could serve as an example for those of you who are creating your own. This template was created using the results of this study and the examples that our partners kindly shared with us. So all of those healthcare organizations who were consulted as part of this study. And as I said, the template is available in English and French for convenience. On this slide, you can also see the header of the policy template. The next slide, this is an example of the purpose of the policy, and we chose for this presentation to talk about the active offer. So this list was drawn from existing language policies, and it can easily be adapted to your needs. You can simply add the name of your organization where it says agency in brackets. Use the elements that apply to your organization, remove those who don't, and add what is missing. The next slide, please. So on this slide, you can see examples of procedures still with regards to active offer. And again, there are many other elements in the template, but this is just to show you an example. Next slide. Thank you. If you don't already know your French health network, we strongly recommend that you connect with them. There are French health networks in each province and territory. Some provinces have more than one for the larger provinces. And we strongly encourage you to connect with them to receive a customized support that is personalized to your needs and to have a follow-up. These experts can also help you to connect with local Francophone organizations, and they can help you prioritize your actions based on your community's needs. And lastly, on the last slide, we want to thank all of the organizations that participated so generously to this study and shared their policies and procedures with us. This work, these results would not be possible without your help, so we're very grateful. And if some of you are on this call today, again, thank you so much.
Thank you so much, Joanne. Thank you, Danielle, for this interesting and relevant presentation. No doubt that many professionals will find this guide helpful for their own initiatives. So now is the time to give the floor to the audience, and this is your turn. So how to participate? You can either choose to write in the chat box or the Q&A box, or maybe you can just raise your hand and we unmute your mic to give you the opportunity to speak. Thank you so much. I'll be stopping this. Okay, I see there's already a question. So this anonymous, merci pour la présentation. Les diapositives du webinaire seront-elles partagées après le webinaire? Yes, definitely. About a week after the webinar, everything will be available on the SSF website. So in the meantime, I have a few questions for you. I see that this guide, for someone like me, I see that there's a tremendous amount of work behind this. So my first question would be, how much does it take to implement such a guide? And what was the most hard steps in the process?
Well, I can start off. I would say it took us roughly maybe a bit more than a year. By the time that we determined what it was we were going to do, how we were going to go about getting the information, the brainstorming to find partners within the community and to contact them and to, according to their availability, and then bringing all of this together. It took about a year. The most energy, I think the most energy was put into communicating with these partners, but that's the richest part of the experience for myself anyways, having these interviews and sharing their experience within, trying to implement French language policies in an Anglophone environment is not easy. And so for some interviewees, you could really feel how much energy and how much passion they put into this work, because they've been at it for some of them for several years. And so it was really heartwarming for me to give them the opportunity to speak about all their challenges and their success stories, and as well their passion about it. It was really, I really enjoyed that.
Thank you so much, Danielle. Do you want to add something, Joanne?
Yes, I just want to say how, as Danielle said, the partner organizations were so eager to help. Like it was, you know, how sometimes people have a certain reserve in sharing their documents, like in research, but everyone that we asked who had French language or linguistic policies shared them, and that was in also their in their eagerness to help, to do whatever they can to support French language services and to support others who need to develop these documents. So that was really a beautiful thing to see. It was something that I really appreciated. And again, very generous organizations.
Oh, that's great. So we could assume that it was really well received by professionals. And I would like to ask another question. And what would be the advice or the procedures to put in place to help people embrace this guide?
I think one of the key elements is to experience it first. Go through the guide, go through the training training module. So experience it and then talk about it to others in your environment. I think that's the best way. Word of mouth is, in my experience, the best way to promote pretty much anything.
Mm-hmm. And from my experience working with service providers in English and in French, I've been hearing for several years the need to have examples for policies and procedures, which is why this project was so exciting, because I really feel that there's a need for this kind of guide. So as Danielle said, yes, I think that we can spread the word. There is a need for this resource, and it's available in English and French. So then there's no need for the agency to have to translate all the, you know, the language that is, you know, for some of those terms, right? It's technical. So you have it. It's already, it's provided in this guide. So I think it's a great tool and everybody should be using it and promoting it.
Okay, thank you so much, Joanne and Danielle. Sorry, we have a raised hand from Hanan. Hanan, I will allow you to talk. So yes, you can give us your question.
Je voulais juste savoir, Annie Boucher avec l'entité de planification des services de santé en français pour Hamilton, Niagara, Haldimand, Brent et Waterloo-Wellington. Je voulais juste savoir si la plateforme avait été, pas la plateforme, pardon, l'outil a été piloté encore. Est-ce qu'on l'a testé? Puis sinon, est-ce qu'on peut vous aider à chercher des candidats pour en faire le test? Puis je suis sûre que Joanne sait où je m'en vais avec ça.
On l'a testé et donc il est maintenant disponible sur la plateforme, donc il peut être utilisé par tout le monde. Si les participants vont sur la plateforme Accès Équité, dans la section ressources, le guide pour les politiques et procédures est là. Et le gabarit fait partie de la formation. Puis je vais vous donner un petit comment dire, un petit tip que vous n'êtes pas obligé même de suivre la formation complète pour y avoir accès.
OK, c'est comme un life hack. Mais si mais juste pour aller plus loin, est-ce que dans ce cas-là, le travail qui a été fait, puis je suis sûre que le travail qui a été fait est parfait, mais est-ce que vous êtes ouvert est-ce qu'il y a un processus d'amélioration continue ou est-ce qu'on dit c'est ça l'outil, puis c'est tout?
Non, je suis certaine que la Société santé en français va être absolument intéressée à recevoir des rétroactions. Comme les autres outils d'accès équité sont renouvelés continuellement. La stratégie de ressources humaines, par exemple, ça s'appelle 2. I'm so sorry, I'm speaking in French, but I think some of our audience
I'm so sorry.
No, that's okay. I wanted to say that our resources are constantly improved and adapted. And for example, the HR strategy now is 2.0 because there was the HR strategy 1.0. So yes, absolutely, Annie, if participants use our tool or our template and have feedback for us, would be happy to receive it and include it in the next review of the tool.
Yes, and again, thank you, Joanne. I apologize for asking in French.
No, that's okay.
My bad.
No, that's fine. We can translate it. That's fine. Thank you, Annie.
Okay. Is there any other questions? Please feel free to raise your hands or to write your question in the chat box. Okay. In the meantime, I have another question. The Equity Link initiative is applicable in all provinces? Is it a model that can be duplicated to other provinces and territories, or is it specific to some regions?
Danielle, do you want to answer? Do you want me to start?
Go ahead.
Okay, thank you. Yes, it can completely be used by any organizations across the country. As Danielle said, it is very important to us to have examples of policies across the country in a different type of organizations or healthcare settings, so that it would be a tool that would be kind of universal. And as I said, the template is organized in a way where we grouped the information that was that as we did our analysis, that was the most common and pertinent, and added what we felt was missing from our research. But this tool is completely adaptable. So organizations, as I said earlier, can use the elements that apply to their situation and just remove what doesn't apply, and or add whatever is missing. And what is, like, especially for procedures, again, many of those procedures will apply to most organizations, but it's possible that some are very specific to yours. If you have like specific procedures to access translation services, for example, some policies that we saw from the organizations that shared their policy with us would say, for example, if you need translation services, call agency ABC at X number from 8 to whatever, right? So, or use this link to connect to translation. So you can absolutely add and kind of, adapt and make those procedures yours. But it gives you a very solid base to have this template.
Thank you so much, Joanne. Do you want to add something, Danielle?
No, that's pretty much what I would have said.
Okay, so we have another question from Anne Martel. Hi, Anne. And the question is the following. I work with Dialogue McGill, who offers language training to healthcare professionals in Quebec. My question, can the template be adapted to the development of the offer of English language services?
I absolutely think so, because this, Equity Link is about equity, right? I mean, we talk about French language services because that's what Société Santé en Français does, but it's really about building equity. So definitely this, I think, and I think Société Santé en Français is on the line. I see that Lise Richard posted something. So if Lise wants to react, please do. But from my understanding, I think completely.
And if I can add, I totally agree. There may be some things that are, for example, active offer, which is perhaps not allowed in Quebec. You would have to work with it, tweak it so that it speaks to your particular environment.
Hi.
Hi, Liz.
Hi. Can you do me a favor and repeat the question?
Yeah, sure. So the question is, can the template be adapted to the development of the offer of English language services?
Oh, that's what I thought the question was. Just wanted to make sure. I don't see why not. As a matter of fact, when the Equity Link was developed, as well as the framework for recruitment and retention of bilingual services was developed, there was a tagline that essentially said, or a footnote that explained that it's completely adaptable. And so, yeah, we encourage that for sure. to it would require an adaptation. I'm sure you're aware, and we could work with you if you're interested in looking into that. It would probably take some resources, but if you want to talk about it further, feel free to give me a call or send me an email. I'll put my email address in the chat box.
Thank you so much, Liz. Joanne, Danielle, would you like to have the final word?
Well, I'd like to encourage all
Just-
managers out there. Sorry, Joanne. I'd like to encourage all managers out there to at least have a look. You know, good models are very helpful tools to develop what it is you need to develop. And so I think it's a good starting point if you're thinking about either developing your own policy or maybe improving on your policy. If you have one, but you want to see if it can be improved, then that might be useful to you as well.
Thank you so much, Danielle. So we have other comments here. Excellent presentation. Thank you, Julie. Thank you for doing this extremely important work. From Annie, excellent session. Thank you, MA. It's great. Okay, Sylvie, she looks forward to do the training. That's great.
Okay.
Okay.
Yes, so again, we encourage you
Okay.
to visit equity-link website, www.equity-link.ca.
Okay.
It's all free, great resources. Please use it and spread the word.
Yes, as a reminder, this presentation and the recording of the session will be available on the SSF website in the webinar section within maybe a week or 10 days. Thank you so much. Okay, and the poll. So great. We'll see you in another webinar, whether in French or English. It's always a pleasure to receive you. So I'd like to tell you, so have a nice day, everyone, and let's see each other again.